if you smoke, you're at an increased risk of having IPF. Some of the risk factors and causes of IPF are similar in the sense that we don't really know what causes IPF. There is currently no cure for IPF. However, there are treatments that are available. Every patient with IPF deserves a multidisciplinary approach to both diagnosis and treatment. It's good to keep in very close touch. Anyone who has IPF, to stay in very close touch with your physician, your pulmonologist. IPF, also called idiopathic pulmonary fibrosis, is a disease of the lung that causes difficulty breathing. Basically, what the disease causes is scarring of the air sacs of the lung as well as the lining of the lung. And this scarring can cause difficulty in the transport of oxygen from the lung into the blood, which eventually manifests as difficulty breathing. Some of the risk factors and causes of IPF are similar in the sense that we don't really know what causes IPF. IPF, we know that certain risk factors, including smoking, for example, if you smoke, you're at an increased risk of having IPF. We know that smokers have a higher rate of IPF than non-smokers. Family history is also an important factor. So if you have certain members in your family who have IPF, your risk of getting IPF we know is higher, as well as some genetic predisposition. People who get exposed to air pollutants, toxic chemicals in the workplace for a very long time, we know can be predisposed to IPF as well. So if you do have IPF, a lot of the times the symptoms can progress very, very slowly, meaning that some people can have symptoms onset much later than when the disease starts progressing. When you do have symptoms, patients usually complain of difficulty breathing when they exert themselves and a dry cough. Some other things that patients complain about includes fatigue, low energy levels, as well as anxiety. Those are the usual symptoms that initially come with IPF. When talking to your doctor about IPF, after presentations, there's no one specific test, include like blood test to test for IPF, but your doctor will perform blood tests to make sure that you don't have any other kinds of IPF or risk factors for IPF or causes that can cause lung scarring, as IPF can manifest in different ways. And then other tests include lung tests, so pulmonary function tests, which are done in a lab, and that measures the amount of air that can expand in a lung, as well as lung volumes. And those tests give us an idea of how progressive and scarred the lungs are. Other tests include a CT scan, and that's a very form of advanced X-ray. It gives us a very good idea of the degree of damage of the lung tissue. Those can be usually repeated every year or as the disease progresses to give your doctor a very good idea about how your disease is progressing. If IPF isn't very clear, a lot of the times what your doctor would do is a lung biopsy. That might be part of the workup if it's not very clear from the CAT scan, the CT scan, that you do have IPF. So in a certain number of patients who have IPF symptoms and changes on their CT scan, a lung biopsy might be one of the things that can be done next. There is currently no cure for IPF. However, there are treatments that are available. So they slow down how quickly the disease progresses, but they don't cure it. And then things like pulmonary rehab is very important. It's strengthening exercises, just as you would do at a gym, tailored to patients with underlying lung disease like IPF, in order for you to develop good muscle strength, to take deep breaths, be able to perform those activities, to strengthen your respiratory muscles, and slow down, hopefully, the progression of disease and improve quality of life. And what I do is I usually refer my patients to pulmonary rehab. However, if you are in self-quarantine, which a lot of people should be doing, I actually have been recommending certain exercise regimens to perform at home. So I would recommend that you call your doctor, ask them what kind of resources they have. They can send you pamphlets of exercises, videos of exercises, things that you can do at home without leaving and breaking a quarantine. The other thing that I would recommend is that if you've already attended rehab and have learned some of the exercises from your rehab instructors and therapists, that you try to do those activities as safely as possible while you're at home. In the treatment of IPF specifically, the inhalers are only work if you have an underlying condition with IPF that would benefit from inhalers. For example, a lot of the patients who have IPFs can sometimes be smokers and have COPD or have asthma that can respond to inhalers. Watching videos, asking your doctor how to use an inhaler properly is very important. Although IPF itself doesn't usually respond to inhalers, what we usually recommend, and as mentioned earlier, is the anti-fibrotic medications. Those are pills. And if you do qualify for using them, they're pills that you take multiple times a day. Other things that are very important in terms of medications for people with IPF to note is that we do know that if you have acid reflux or heartburn, that can make your IPF worse. So a lot of times your doctor will make sure that you don't have any heartburn or acid reflux and treat that. And like I said, the triad usually that I think about when I see patients with IPF are whether or not they need the anti-fibrotic treatment, which are the oral pills, whether or not they have acid reflux and they need treatment for that, and then the pulmonary rehab. And those are the mainstay therapies before you reach a stage where you would need a lung transplant. Every patient with IPF deserves a multidisciplinary approach to both diagnosis and treatment. Every case at NYU gets discussed by the pulmonologist in conjunction with the radiologist who reads the images and scans, as well as the surgeon. Sometimes they need to have surgery done in terms of lung biopsy. The pathologist is always involved as well if the biopsy is needed, as well as the pulmonary rehab team. So a lot of the times cases of IPF are presented at NYU almost on a weekly basis at a multidisciplinary meeting. So every patient who has IPF deserves that sort of like treatment approach, because you want to make sure that, like we discussed earlier, there's nothing else that mimics or looks like IPF that you could be missing. So you have pulmonologists like myself in conjunction with the radiologist, surgeon, pathologist, and then other subspecialties, including rheumatology, for example, as other things that can cause pulmonary fibrosis can be secondary to rheumatoid arthritis or lupus or scleroderma. So that's the multidisciplinary team approach. And then your primary care physician also is a very crucial component to this, as they are the base person who refers you to the pulmonologist and keeps track and as well manages all of your other medical conditions. And in times like the coronavirus, it's very important to practice things like quarantine, isolation, wearing masks, practicing hand hygiene, sanitizing surfaces. Those are all very important things. Make sure that you call your doctor and make sure that you stock up on all of your medications so you have enough of them at home. Disinfect surfaces that you touch. Have a hygiene or a sanitizer ready in your pocket. If you do manifest symptoms, which coronavirus patients might have, like cough, fevers, shortness of breath, that's more than usual in IPF patients. These patients then definitely need to reach out to their primary care doctor or pulmonologist to get tested, because IPF can cause exacerbations. And those exacerbations in IPF are usually a result of an infection or just progression of the underlying disease state. It's good to keep in very close touch. Anyone who has IPF, to stay in very close touch with your physician, your pulmonologist. As I do a lot of the times, I have very regular follow-up every 3 months, maximum every 6 months with my patients to make sure I do lung tests, CT scans if needed, and assess their oxygen needs, as well as make sure to do pulmonary rehab and activity. The Pulmonary Fibrosis, the Idiopathic Pulmonary Fibrosis Foundation is a very good source. Your doctor is a very good source. A lot of what's been happening recently with healthcare is that a lot of physicians are conducting telehealth and virtual health visits. So I would really recommend that you reach out to your doctor. We have so many resources that we can give patients, including websites to read, including resources on exercise to do at home, like I mentioned, in terms of trials for new medications that are happening in the world of IPF, because there's something new that's happening all the time. And while we are using 2 medications, sometimes your doctor can provide you with trials that are ongoing for different medications that are being sort of trialed out on like a randomized controlled trial at your institution that can really help to read about it while you're in self-quarantine, including other things like reading about your exacerbation risk, the severity of the progression of your disease, and what things to avoid during a time when you're at home and unable to leave for very prolonged periods of time.